So going to work through some hip mobility. We're going to start with some soft tissue. You can use a baseball, lacrosse ball, foam roller, Theragun, whatever tool you want to use. I'm going to start using my foam roller, putting it on my glutes. I'm going to sit on it. This is another one we're going to have to roll, but let's get our timer ready. We're going to do it for a minute. So if I'm rolling back and forth here through my glute, I'm going to roll a little bit on the side, a little bit more on the back. You can roll that leg over. I'm using my bottom leg to kind of drive that motion back and forth. Don't do this directly on your side. We don't want the foam roller going right on top of that hip bone. But if you can get it through the glutes, throughout the back side, sometimes it feels good to get down into the hamstring a little bit. We just kind of move things around. Again, we're going to do a minute on this side, a minute on the other side, go into a mobility exercise, and then finish up with a stretch. So starting with just this desensitization tactic, trying to get that tissue a little bit more pliable, take the nervous system and down-regulate it slightly so that we can access a larger range of motion, access a larger stretch. So let's switch sides over here and get the watch going. And again, if you want to use a foam roller, if you want to use a Theragun, you can use your lacrosse ball, whatever tool is good for you to use for the soft tissue, totally fine. It might be nice to experiment with a little bit of variety just to see which one the body responds best to. For me, the foam roller always feels pretty good. It's pretty easy for me to use. I can take it anywhere. It's not as convenient as, say, a lacrosse ball, but sometimes a lacrosse ball to me is a little bit too pinpoint, where the foam roller distributes that force a little bit better. So keep things rolling, keep things moving, getting work through that hip. Again, stay off of the complete side, but sometimes it feels good to get a little bit more force on that direction. Kind of shift your body weight, maneuver things. Yeah, 10 more seconds, foam rolling, and then we're going to go into a hip mobilization. All right, so you can set your soft tissue tool aside. We're going to get into a 90-90 position. So we're trying to access this position here. So you can see I may have a little limitation on this side. I might think I'm leaning to the side. Use your hands to kind of sit yourself upright. Feel that stretch in one hip and the other. We're trying to keep the shins flat on the ground and getting in this figure four kind of 90-90 position at each foot. And then what we're going to do, and I'm going to tilt to the side so you can see, is we're going to go here, hands on the ground, and we're going to rotate. And I'm going to pause, 2, 3, 4, 5, rotate. Pause, 2, 4, 5, 2, 3, 4, 5, 1, 2, 3, 4, 5, and going back and forth. 3. And this is number 5, and 5, and rest. Then straighten the legs out, shake things out. This might be a pretty aggressive position for some of you. So if you can't, when we do our second set of 5, if we can't get all the way flat, that's okay. If you're somewhere like this, where your knees aren't quite getting to the ground, that's okay. Over time, it'll get there. So take about a 10, 15 second rest, get back in position. We'll go 1, 2, 3, 4, 5, and switch. 1, 2, 3, 4, 5, switch. 2, 2, 3, 4, 5. You should feel like you can get more upright as we go. 2, 2, 3, 4, 5, 3, 2, 3, 4, 5, 3, 2, 3, 4, 5, 4, 2, 3, 4, 5, 4, 2, 3, 4, 5, and the last one, and then 2, 3, 4, 5, and 5, 2, 3, 4, 5. Another alternative, if you can't hold this position, your legs have to shift out, whether this leg's further back, this leg's further out, your knees aren't down, just trying to get into this position as close as possible. So soft tissue, we did the 90-90 stretch back and forth. Now we're just going to do a knee hug and hold this stretch for 30 seconds. So I'm crossing my leg over, gripping my arms around my knee and pulling it in this direction. We're not just hugging the knee, we're trying to pull and rotate around our body, feeling the stretch through that backside. So let's get into that position, pull, we're trying to hold for 30 seconds. You should feel a gentle pull along the side here. Again, we don't want this to be a painful, hurt so good sensation. Should be a nice, gentle stretch. Here, stay nice and tall. Don't slouch. Remember, running posture is extremely important. An upright trunk, an upright posture leads to better running performance. And switch. So switch, we're gonna rotate over and twist to the side. We're not really torquing it, but the force production is gonna be more that way. So if I loop my hands around, I can get that position up here. Again, trying to stay tall, feel a nice gentle stretch through my hips. This routine should take you about 5 minutes. So we have a minute on each hip with the soft tissue. Going back and forth, we're doing 5-second holds on each side. So that's gonna be 5 times 5 is 25 seconds on each side. Going through that twice, so it's just shy of 2 minutes. But if we take a break, if we take the rest in between, that gives about 2 minutes, and then 30 seconds on each side here gives you 5 minutes of the exercise. If you do a couple extra stretches there, you can get to 6 or 7 minutes, depending on what time you have. That's a good quick 5-minute hip routine.